so we're going to do trach cares for this patient. So we've come in, we've introduced ourselves in our department, and we've done our assessment on our patient, including breath sounds and vital signs. So we're ready to get started. So first we need to hyperoxygenate our patient. So we're going to use the ambu bag attached to the trach, and we're going to hyperoxygenate our patient. And then once our patient's been hyperoxygenated, we're ready to do the suction. So we're going to open the suction kit, and we're going to apply the sterile gloves, and we're going to have one sterile hand and one clean hand. And using the clean hand, we're going to remove the suction and kit, or the suction catheter. We're going to hook it up to the wall suction, -120 to -150 for an adult. And then using the sterile hand, we're going to grab the catheter, and we're going to place it into the basin where there's normal sterile saline, and we're going to occlude the thumb port so that we can make sure that the suction does work. Once we know that the suction works, we're going to use some water-soluble lubricant. We're going to squeeze it into the sterile hand and run the catheter through to ease insertion. And then we're going to insert the catheter into the trach until the patient coughs, at which point we'll occlude the thumb port and remove the catheter, and the whole process should take less than 15 seconds. Once we have performed the suction, we're ready to do trach cares. So we're going to remove our gloves, wash our hands, and then we're going to open our trach care kit. Inside of our trach care kit, we have a basin that we're going to fill with hydrogen peroxide and sterile saline, and then we're ready to do the trach cares. So we have our clean gloves on, and what we're going to do is remove the inner cannula. It's disposable, and we're going to reinsert a new clean inner cannula, and then we're going to remove our old dressing and discard of it, and we're going to cover our patient with the drape, and then using the basin that has our peroxide and our saline, we're going to clean the outside area of the trach. And we're going to hold the trach while we do it so we don't accidentally decannulate the patient. And then we're going to reapply a new gauze dressing to the site, and we're going to remove the old dressing trach ties, and we'll put a new one on there. And then we'll dispose of our dressing, and we need to reassess the patient for oxygenation status, ventilation status. We need to make sure that the trach's in the proper position. We're also going to assess the patient's vitals and breath sounds. And then we're going to make sure that our patient is comfortable and they're not experiencing any respiratory issues, and then that will be it.